Welcome to Webisode 5 on the effective use of the Controlled Substance Reporting System. I'm Eric Morse, an addiction psychiatrist who has over 18 years experience working in opioid treatment programs. North Carolina's Controlled Substance Reporting System, or CSRS, also known as PMP Aware, is a valuable tool for providers working in OTPs. This program can help us provide safer and better informed care for the patients we serve. Currently, OTPs do not report data to the CSRS. Because of this, other providers in the community have no way of knowing that our patients are being prescribed methadone or buprenorphine at our OTPs. This puts the burden for checking the CSRS on OTP providers to check new and existing prescribed controlled substances. Will issue a mandate saying that all practitioners who prescribe opioids for chronic pain must check the database prior to the initiation of treatment, and at least once every 3 months for continued opioid prescriptions. Given that OTPs by their nature treat patients with opioid use disorder, it seems advisable for opioid treatment providers to meet these goals now, rather than waiting until they're mandated. All patients entering OTP treatment should be checked on the North Carolina Controlled Substance Reporting System along with border states. OTP providers should check patients on the CSRS once every 3 months. This task is easier now that prescribers can designate delegates to help. Data from the CSRS can help providers in several ways. After an initial evaluation, data from the CSRS may support a patient's history of opioid use. If we see extensive history of prior opioid prescriptions, it should fit with a patient's history of opioid use and support the diagnosis of opioid use disorder. If the patient is receiving prescriptions for sedative medications that could be harmful while on buprenorphine or methadone, we can see that on the CSRS report. We might adjust our treatment plans accordingly, possibly by starting at a lower induction dose, getting permission from the patient to coordinate care with other prescribers, or other choices. Benzodiazepine prescriptions shouldn't keep patients out of treatment, but may influence how and where the treatment is started. Patients who misuse their benzodiazepine prescriptions are at higher risk of bad outcomes. Such patients may need to undergo induction onto methadone or buprenorphine at an inpatient facility. While benzodiazepine dosage is reduced or gradually withdrawn under physician supervision, in some cases, depot naltrexone may be a safer option for some patients. Some OTP practitioners may be comfortable with outpatient induction of such a patient, but limit a maximum maintenance dose until the patient is off benzodiazepines, or at least until the patient has tapered to a lower dose. Regardless of the approach, coordination of care will need to be done with the benzodiazepine prescriber. Occasionally, patients actively enrolled in office-based buprenorphine programs may seek admission to OTPs. If we see such a situation on the CSRS, coordination of care should be done with the OBOT provider to prevent dual enrollment and dual prescribing. If a new patient is currently receiving opioids from another prescriber, the OTP provider will want to get permission from the patient to discuss treatment with the other provider. If the patient has an active prescription, the OTP provider needs to decide whether it is safe to start an induction. In most cases, the provider will want to see evidence of some degree of withdrawal as confirmation that all previous opioids have already been used. Information from the CSRS should never be used to embarrass a patient or try to catch them in a lie. Patients should be informed that the CSRS will be consulted upon admission and periodically throughout their treatment. If an established OTP patient is found to have an unexpected prescription during routine checks on the CSRS, the provider should meet with the patient and ask about the medication in a respectful way. If the new medication could be harmful, possible solutions should be discussed. The OTP provider may need to ask for permission to contact the other provider to work out the best plan for treatment. Short-term, short-acting opioid prescriptions for acute pain maladies such as nephrolithiasis, broken bones, or surgery are generally approved for use by OTP patients since their maintenance medication of methadone or buprenorphine won't provide pain relief. Chronic, more than 3 months, opioid prescriptions are rarely appropriate for patients with known opioid use disorder, and there's limited data to show improved relief of chronic pain from long-term opioids. OTPs should have a prescription verification process where the patient turns in all prescriptions to the nurse to be entered into the medical record. Compliance with the policy and regular checking of the CSRS are helpful in keeping our patients safe. Patients with take-homes should be compliant with this process. There are errors in the system, and providers should make certain that all forms of the name are checked, like Jim and James, or Rob, Bob, and Robert. In North Carolina, lots of patients seem to go by their middle names, so you may need to check both. If you have a common name like John Smith, there may be more than one born on the same day. You may need to call the pharmacy to get clarification. The CSRS should be checked when determining safety for take-homes, both earned and special take-homes. CSRS results are expected to be included in CSAT extranet exception requests to NC-SOTA and CSAT for special take-homes or earned accelerated buprenorphine take-home requests. The use of our state's CSRS is an important tool that can keep our patients safer. We want to keep patients engaged in treatment, so unexpected data found in the database should be viewed as a starting point for a conversation with the patient and not used as an excuse to kick somebody out of treatment. If you have further questions, please feel free to contact your state opioid treatment authority. Thank you so much for watching, and keep up the good work.